A surprising new survey from American Dental Association reveals Americans scored a D on oral health quiz and are severely lacking in their knowledge of oral health. What we don't know can hurt us. So Dr. Maria Lopez Howell, consumer advisor with the ADA, has suggestions to help us brush up on oral health. Good morning. First, tell us about the results of the dental IQ quiz.
Well, mouthhealthy.org, which is the website that we're actually launching, the American Dental Association is launching this week, is the website where you can find this information. There's a quiz there. But before we even get to the quiz, there was a survey done for Mouth Healthy to find out what people knew, and the results were shocking. Americans really responded very poorly. We got a D, in fact, on our dental knowledge and how to take care of our mouth.
So what were people missing? What were you most surprised at with the survey?
Well, I think I was most surprised at on a few things. People don't seem to know how often you should, or when is the first time you should take your child to the dentist. 3 out of 4 people don't know that. 3 out of people don't know that sugar doesn't cause tooth decay. It's the acids that are produced by the bacteria in your mouth is what actually causes tooth decay. And real importantly, 3 out of 4 people don't realize that a dental infection, tooth decay, and gum disease can actually be transmitted from one person to the next. When you see these families who suffer from tooth decay or from gum disease, it's not really that they have soft teeth or bad gums, it's they've been passing around this infection to one another.
Wow, I didn't know that either. Yeah. What are some of the most
very important stuff? And you actually this website is so neat because it's basically organized in life stages. So if you're pregnant, or if you're young, or if you're older, or if you're a parent, you can really look into this website. You can take a quiz that's basically targeted to your life stage. Find out what you don't know and learn how to take care of your mouth so you can have not only you but your family smile healthy for a lifetime.
What's the difference between the quiz and the survey? Because we touched on the quiz, I think, a little bit earlier.
The survey actually gave us the information that we didn't know a lot. That's where we found out that Americans were scoring lower. And then the quiz that's on the website, it's specific for you. You can take the quiz and find out what you don't know and what you know. And learn.
And learn all of these things that we do need to know. And of course, there are a lot of myths out there regarding oral health. Can you tell us some of the most common ones?
A common myth is that you have to brush your teeth after every meal. And we want to make good oral health as simple as possible for you. Brushing twice a day with a fluoride toothpaste and a soft bristle toothbrush and flossing once a day is pretty much all you need to do at home for prevention. You don't have to brush after every meal, but twice a day thoroughly is what's going to do the trick for that. I think another myth is that people think they don't have to change their toothbrush but maybe twice a year. And what we know is that when these toothbrushes get frayed, when the bristles get frayed, they're not effective at removing plaque anymore. And that usually happens after about 3 or 4 months. So make sure that you are looking at your toothbrush every 3 or 4 months and making sure that they're not frayed. Because if they're frayed, they're not going to be doing a good job.
Okay.
Those are a few of the myths.
So brushing, flossing, what about mouthwash? Is that, how important is that, would you say?
A fluoride mouthwash is helpful as well, but it doesn't replace brushing and flossing. Those are just the 2 key components of prevention, along with visiting your dentist regularly to make sure that you're doing everything that you're supposed to be doing for your good oral health. Mouthwashes can help, but they don't replace the good oral hygiene of removing the plaque that causes that makes acids that cause tooth decay.
Right. Now, what do you think is one of the best ways to get a healthy smile?
You know, again, it's prevention. For pennies a day with a soft bristle toothbrush, a fluoride toothpaste, piece of dental floss, with those few things, you at home can really be on the road to good oral health. One of the other things that we found out on the survey, and I think is important just on a daily basis and in keeping good oral health, is that what we found out is that the dental disease, or it's an infection, can be transmitted from one person to the next. So in a family, you know, try not to share spoons and cups and snacks if you can, because we know that if the mom and dad have dental infections, the kids are probably going to be at risk for those infections as well. So care and not share, basically, is what we're trying to tell you, is caring about your family and not sharing food utensils and snacks and cups that might lead to transmitting the risk for decay and gum disease to each other.
That's good advice. Now, I did want to ask you one more question. As far, everybody wants a really brighter, wider smile. Are those, like the toothpaste that you use to get those glowing white teeth, are those just as good as the regular toothpaste?
As far as tooth whitening, the best thing to do is to talk to your dentist, because it will depend on if you've whitened before. It will depend on whether you've got fillings, whether you've got crowns, the type of enamel that you have. It's just so different for every patient, and the best way to know whether you can get your teeth whiter is to speak with your dentist and find out what your personal needs are. And a lot of people think that people with wider smiles have healthier smiles, and that's usually, that may be true, but in many cases it may not be true. If you are not doing what you need, those simple things of brushing and flossing and seeing your dentist regularly to find out if your teeth are in fact healthy is the true key to knowing whether that bright white smile is healthy or not.
Okay, well, thank you. So much good information. Where can our viewers go for more info?
For more information about your health and what you know and what you don't know, please visit mouthhealthy.org, the American Dental Association's new website. Take the quiz, find out what you know, find out what you don't know, and learn about how to get better oral health.
Okay, thank you so much, Dr. Maria.
Thank you, Kristen.
We'll be right back.